In this lecture, we're going to continue our coverage of the arteries that will serve the upper extremity, the trunk, and the lower extremity. And when we start here on the right, here we see that the subclavian artery, this particular one on the right hand side, and this is bilateral, extends into the arm and becomes the axillary artery, where you see numerous branches that will supply various parts of the shoulder girdle, including the torso. The axillary artery continues to move distally along the arm and will become the brachial artery. And the brachial artery is the one where a person can feel their pulse on the medial side of their upper arm. Now the brachial artery will then branch, and we move over to the left-hand side, as you can see here, into the ulnar artery, which will supply oxygenated blood to tissues on the medial forearm, and the radial artery, which will do so on the left-hand side. And when we get down to the wrist, the radial artery on the thumb side is the one that we would typically use to measure our pulse. Those two blood vessels will merge into a arch referred to as the superficial palmar arch, which then gives off various branches that supplies oxygenated blood all the way through the distal portions of the fingers. Moving over to the trunk, we start here by pointing out the diaphragm muscle, which is a skeletal muscle that's responsible for breathing. And this muscle separates the thoracic cavity from the abdominal cavity, and being a muscle, it does require an oxygen supply as well. So blood is diverted to, or blood is, moves towards the diaphragm, and you can see here the inferior phrenic artery does just that. On the left-hand side here, the celiac trunk, which is an extension off the what is the abdominal aorta, will supply the superior abdominal viscera, so the organs that make up the upper portion of the abdominal and digestive system. We can see here the bilateral, only indicated on this side here though, is the renal artery, and the renal artery delivers oxygenated blood to the kidneys, where that blood is cleaned and then eventually returned back to the general circulation. Moving over here to the right, right before we get to the renal artery as we move inferior, is a small branch that extends to the adrenal glands, and this branch is just simply referred to as the middle supra on top of the kidney renal artery. What you see here that's cut off is the superior mesenteric artery, and this is an artery that supplies oxygenated blood to the intestines. And the major central vessel here, of course, is the abdominal aorta. Further branches, as you can see here, we have the gonadal artery, which supplies oxygenated blood to the reproductive organs. The inferior mesenteric artery, being a small branch, as you can see illustrated as we move more inferior along the abdominal artery, and this supplies oxygenated blood to the distal half of the large intestine. And then the abdominal aorta will then branch into the right and left common iliac artery, and the branches will serve the abdominal wall, further tissues within the genital area, and they will continue into the lower limb. As we take a look at these vessels here, we start on the left-hand side with the external iliac artery, and the external iliac artery will extend into the femoral artery. And the femoral artery will then continue to move inferior and all the way through, it will continue to supply and branch for the tissues of the thigh. And the popliteal artery moves through the middle portion of the knee joint and will then become then branch into the anterior tibial artery. Starting at the very top here we see once again from the posterior view that popliteal artery that moves through the actual joint and gives rise to a branch which is the anterior tibial artery, but it will continue and then branch into the posterior tibial artery and the fibular artery, where those will continue into the foot in a very similar manner with the hand, where it forms this arch that continues to supply the tissues of the foot and toes. On the right hand side here, we go back up to the abdominal region, where the abdominal aorta branches once again into the common iliac artery, which then gives off a relatively small branch, which we call the internal iliac artery. And once again, as illustrated on the far left hand side, the external iliac artery is a relatively large continuation of the common iliac artery. So this ends this video on coverage of the specific arteries coursing through the body.